Hi, I'm Linda from English Learning Mind Map. Today, we will learn about clinical diagnostics. Clinical diagnostics. To detect pathologies and confirm suspicions through clinical diagnostics, doctors follow a step-by-step logic. Basically, they are trying to find out what is making a person feel sick. Symptomatic assessment. As a core pillar of clinical diagnostics, symptomatic assessment allows a doctor to observe manifestations and record complaints. In simple terms, this is when the doctor looks at the patient and listens to their story. Physical examination. Physical examination is a branch of symptomatic assessment where the medical team will check vitals and inspect tissues. This means the doctor looks at your skin, eyes, and throat to see if they look normal. Clinical palpation. During clinical palpation, the doctor will use their hands to feel masses and assess tenderness in the stomach or neck. To put it simply, they are touching your body to find hard lumps or see where it hurts. Medical history. Medical history serves as a functional layer of symptomatic assessment to trace patterns and review records from the past. Essentially, the doctor is checking your family's health to see if your problem is inherited. Genetic screening. Within medical history, genetic screening helps to identify markers and predict risks for future illnesses. In other words, scientists look at your DNA to see if you might get a specific disease later in life. Laboratory analysis. Laboratory analysis is a vital branch of clinical diagnostics used to extract samples and measure levels of chemicals in the body. Simply put, this is when they take your blood or urine to test it in a lab. Hematological testing. Hematological testing is a core part of laboratory analysis, where experts count cells and screen blood for infections. This means looking at a drop of blood under a microscope to see if you have enough red or white cells. Biochemical profiling. Under the umbrella of hematological testing, biochemical profiling is used to track enzymes and monitor glucose levels. In short, they are checking the sugar in your blood and how well your liver and kidneys work. Microbial culturing. Microbial culturing is a functional layer of laboratory analysis used to grow bacteria and isolate pathogens from a patient. Effectively, they let germs grow in a warm box so they can see exactly which germ is causing the fever. Antibiotic sensitivity. To finish microbial culturing, they perform antibiotic sensitivity to test resistance and select treatments. At its core, they try different medicines on the germs to see which one kills them the fastest. Radiological imaging. Radiological imaging is a critical requirement for clinical diagnostics to visualize organs and capture images of the inside. Effectively, doctors use high-tech cameras to see your bones and heart without surgery. Non-invasive scanning. Non-invasive scanning is a strategy within radiological imaging used to produce slices and map structures of the body. This involves using a machine to take many thin pictures that show the whole inside of a person. Magnetic resonance. By using magnetic resonance, doctors can display nerves and scan brains with incredible detail. To put it simply, they use giant magnets to see the soft parts of the body that X-rays cannot find. Contrast radiography. Contrast radiography is a technical application of radiological imaging used to inject dye and highlight vessels. In simple terms, they put a special liquid in your blood so your veins show up brightly on the screen. Angiographic imaging. To perfect the view, angiographic imaging allows the doctor to trace flow and find blockages in the arteries. This means watching how the blood moves through the heart to see if any pipes are clogged. Differential diagnosis. Differential diagnosis is a fundamental goal of clinical diagnostics to exclude options and narrow focus to one disease. Basically, the doctor looks at all the tests and says, it is definitely this illness and not that one. Prognostic evaluation. Prognostic evaluation is a core part of differential diagnosis used to estimate outcome and gauge severity of the sickness. This means the doctor is guessing if the illness is dangerous and how it will act. Recovery projection. Under the umbrella of prognostic evaluation, recovery projection is used to plan therapy and predict health for the future. In other words, the doctor decides on the best medicine and tells you when you can go home. Treatment validation. Treatment validation is a practical goal of differential diagnosis used to verify efficacy and adjust doses of medicine. Essentially, the doctor checks if the pills are working and changes the amount if you are not getting better. Clinical monitoring. Through clinical monitoring, the team will follow progress and ensure safety for the patient every day. To put it simply, they watch you closely in the hospital to make sure you are recovering and that the medicine is safe. Thanks for watching. Please like and subscribe for more English lessons.